A new year is just about to begin, and with it comes some big changes in healthcare when it comes to taking care of your heart. Dr. Darryl Elmouchi is a cardiologist with West Michigan Heart, and he has big news about the growing team that he's part of. We're so glad to have you here today.
Thanks so much.
You know, West Michigan Heart is a big presence in our community, so it's always interesting to all of us when there is a big change involving an entity like that. What's happening, so you can explain a little bit.
Sure, so maybe I'll start by saying really nothing's changing in terms of if you're a patient at West Michigan Heart, you come to see us, it's exactly the same in the future. The difference is we're fully merging with the Spectrum Health Medical Group, so we'll be able to offer comprehensive care to all our patients across the spectrum.
Yeah.
No pun intended.
What can people really expect from this? You said very little. I mean, you're going to get the same care, but maybe there are some benefits or some, you know, things that will look a little bit different or feel a little bit different.
So the obvious differences will be the sign on the door looks a little bit different,
Yes.
the business cards look different. Aside from that, the real benefits are, as opposed to seeing just a cardiologist where we're taking care of your heart, now you'll see a whole team of doctors. So it will be cardiologists, internal medicine doctors, specialists of all sorts that are all under the same umbrella. So we'll be able to share your records, share your care, and really look at you as a patient, not just as a heartbeat.
Yeah. You know, I know that's really important to Spectrum Health, the team approach.
Absolutely.
How does that benefit your patient to have so many experts that are right there at the ready and able to work on you, with you?
So imagine this, imagine you see a doctor normally and the doctor writes a letter about you and sends it via mail to another doctor who sends it to another doctor. That's the system we've all lived in forever. This system is different. Suddenly, a doctor sees you, writes a note, it's in a computer screen where I see you an hour later and I have that note in the computer. We share care, and sharing care really cuts down cost and increase quality.
And what kind of specialties will you cover?
You know, we're going to keep covering the same specialties we do, which is the most comprehensive suite of cardiac care in the west side of the state. Everything from prevention, so trying to keep people well out of the hospital, all the way to heart transplant and everything in between.
That's wonderful that we have that resource here. I think that people don't often realize it until they have someone that they love or perhaps themselves that gets sick or needs that kind of care. But it's all right here.
Absolutely.
And so there's a website. So if people have questions, spectrumhealth.org/health. And we're looking at it right here. This is really a lot of information. People can go here and have their questions answered.
Absolutely.
Yeah, that's wonderful. We also have your contact information. So if people are in need of an expert, what they need to do, obviously, you probably get a lot of referrals from other doctors for a specialty like that. But personally, what kinds of things do you do as a cardiologist with this group?
I'm actually a heart electrician. It's called an electrophysiologist, and even my mom doesn't really know what it is. And so I, and actually we have the biggest team in the state, do all sorts of procedures for people, taking care of their heart rhythm. Everything from putting a pacemaker in for a slow heartbeat to going from the groin up into the heart and burning or freezing away areas that are causing abnormally fast heartbeats. Everything in between, and so we have a really comprehensive suite of procedures and medical care we can offer for people with abnormal heartbeats.
Yeah, the technology is amazing
and changing every day.
Yeah, and I know that you're staying on the cutting edge, which is always really great to know. Thank you, Dr. Elmouchi, for coming in.
Thanks for having me.
Explaining this a little bit and how it's going to affect people in West Michigan. We'll have much more 8 West when we come back.
This is 8 West.